So I want to take a minute to really talk about acne. There's a lot of people out there on a daily basis who suffer from acne. And there's a lot of different reasons why people have acne. Some of that could be hormones, especially as a teen or, a younger individual, or maybe a woman going, before having children versus after having children. A lot of times after having children, they'll clean them up, clear them up. So here are some of the things that you should know when it comes to trying to treat acne. Number one, especially if you're a girl or a boy and you're a young teen, typically a lot of that is going to be more hormonal. I am not someone that believes in, especially young girls being on birth control and things like that. There's a time and place for everything. So some of the best things you can do is just take baby steps. One, getting a couple chem pills. You'll know if it's going to be more of a hormonal acne based upon your results when you start doing facials and chemical pills. So this is the first place to start. Look at your diet. If you're eating a lot of sugar, what you put into the body is what you're going to get out of it. So make sure that you're getting enough hydration, enough water. So if your diet's good, you still have acne, we'll move on to the next step. The next step is to watch which products you're putting on. You want to have a good salicylic sort of facial cleanser. A big misconception, what a lot of people do when they have acne, they tend to over clean their skin because they think it's a form of dirtiness, when really it has nothing to do with how clean you are. In fact, the more you clean your skin and wash your face, you're probably making that acne worse. Because what happens is you tend to over dry your skin, which kicks in your sebaceous glands that make them hyperactive, and you begin to create more oil, and it will make everything worse. So some things are only cleanse once, and that's at night before you go to bed. As you sleep throughout the night, your body's sebaceous glands will produce the correct amount of oil onto the skin. If you need to in the morning, when you wake up in the morning, just use water, wash your face, but try not to use any soaps that morning, because once again, your body worked all night to produce the correct amount of oil. As you can always use a toner throughout the day if you feel like you're starting to get a little too oily. If at that point it really isn't clearing up, then you can come and see me, or if you come in and you do a consultation with me and you don't feel like you like me very much, I can always try to refer you out to someone, because at the end of the day, you want to get along with your clinical provider. They should really be your best friend. You both should have the same goals in mind. So start there. Start doing a couple chemical pills. Once again, don't buy a big package. You should start to see really great results after 2 or 3 treatments. If you don't see good results after 2 or 3 treatments, not a facial but chemical pill, from there is a procedure called blue light. It's called Levulan blue light therapy. I offer it here in my clinic. It's about $450 a treatment. It has a very high success rate. It's like doing Accutane without ingesting it. It's topical, and it knocks it out. Most clients who do Levulan, the success rate is about 85%. It can cure acne. So you start there, and typically that's 2 to 3 times. If you don't see a high reduction, at least by 40 to 50% after your first Levulan treatment, don't do it again. So you can start there. If it still continues, then seek your physician. A lot of times they'll put you on an antibiotic. What most people don't know is the antibiotic's only good for 30 days. If you don't see a great improvement after 30 days, you don't need to continue on antibiotics. It's kind of a waste of time. Don't do that. If you're a girl, you can talk to your mother, or if you're a woman, depending upon your age or whatever, you can speak to your doctor about birth control, because that can really have a big impact on it. It has cleared a lot of clients up. Your last resort for anybody out there is Accutane. It's a very, very serious drug. Now, it does wonders. It has the ability to change people's lives in such a positive way.
Is it topical?
It's an oral.
Okay. Okay.
It's prescribed by your physician, it's covered by insurance, but that is the last procedure you ever want to do. It can have very long-term reactions in the body. However, for someone with horrible cystic acne, those risks are far less than what the scars, both physically and emotionally, you know, an aggressive acne can have on someone. So there's a time and place for everything. But I always tell my clients, if people come to me, I can guarantee them 90 days I'll have them cleared up.
Wow.
And we've been able to do that.